The best way, this kind of piggybacks on Robert Cialdini concept, it's the idea of leveraging the moment. The best way to convey this message is face to face, either by the doctor or team members. Could be an assistant, could be a hygienist, could be an admin team member, and it could be related to unscheduled treatment. It might sound like this. I'm your hygienist, Naren. Naren, I see the doctor has recommended some fillings on the upper left. And I see that they're uncompleted in the treatment plan. Now, these fillings won't get better by themselves. Fillings only have a way of getting worse. And if we wait too long, it could end up that we can't replace them with fillings. They might have to be replaced with a root canal and crown. And I'd like to avoid that for you if possible. I'd like doctor to take a look and give us a status report when she comes in today to do the hygiene exam. I'd like her to take a look and give us a status report. But it might be really useful to get this scheduled before the end of the year so we can use benefits that you have. Remember, if you don't use your benefits, Naren, when the clock strikes midnight, December 31st, those benefits don't carry over to the next year for you. They go back to the fat cats of the insurance company. So that's in the face-to-face messaging, that's leveraging, that's in the concept of leveraging the moment. Because now it's just not a random message, but it's related to the diagnosis of fillings for them on their upper left. It's related very personally to them. And that's an example that Robert Cialdini would say is leveraging the moment. Because they're there, they have that need, you're talking about them, what's everyone's favorite topic? Themselves, and you're talking about saving money because using benefits that they have. Very much an example of the Robert Cialdini concept of influence, of leveraging the moment. Does that make sense, Naren? I know you're an avid student of Robert Cialdini. Does that make sense?
Yeah, absolutely, Gary. I think what I like about this approach is, when they are in that moment, when they are receptive to that message, where they are happy, they like you, they are in your practice, that's when, what you're going to convey is going to register and they're going to do something about it. So literally before they even leave the office, you could book that treatment, unscheduled treatment.
Better yet, Naren,
yeah.
If it was possible, I'm not going to say what I'm going to suggest is possible every time, but if it's possible, how would this sound, Naren? Naren, of course, today we have you scheduled for a hygiene appointment. If you'd like to get those fillings done today, I can move you in this room at the end of your hygiene appointment and we can get it done for you today and save you a trip and help you use those benefits.
Right.
Now, I'm not assuming that's possible 100% of the time. That's the idea of adding in same-day dentistry.
Right.
But for the right type of appointment, maybe it's a two-surface filling on one tooth. I would suggest that any of our listeners could add that into the schedule without the wheels falling off, right?
Exactly.
And you might look at that and say, well, that's not very much production. But you know what? Every little bit adds up. And
100%. And like you said, otherwise it'll go to the fat cats of the insurance company. So
and we save you a trip. I mean,
yes.
How resonant is that messaging for any of your parents, whether they're a executive, a student, college student, or a mom? Everyone. What's everyone's most important commodity? Their time.
Time.
I can save you a trip, Naren. We can do that for you today. Now, I'm not assuming that that's possible 100% of the time. Let's get into the weeds a little bit, Naren. And what I mean by getting in the weeds, one of the things that you can do to really make this potent in your practice, the use it or lose it message, is ask your insurance coordinator to do the research on patients on your schedule today and identify patients on your schedule that have benefits left. Now, we don't always know that 100% of the time, Naren. Because if the patient has gone to a specialist and utilized some benefits, we may not know that. But we have a pretty good snapshot of whether there's any benefits left. Have your insurance coordinator identify patients who have benefits left and also combined with unscheduled treatment. Put the two of those together, and now we're really leveraging the moment because now we're talking to people that we know, have the need and have the insurance resources for that.